prolonged high blood sugar isn't going to make you feel different right away. That's exactly why so many people let their guard down until their lab results or their vision starts to change. If you're in your 60s or older, this video will help you spot the early warning signs and know exactly what questions to ask your doctor at your next checkup. The scary truth is that living with high blood sugar for years can leave much more severe consequences than you might think. Strokes, weakness, or paralysis from cardiovascular events, vision loss, chronic kidney disease, and burning, tingling, or completely numb feet that make it dangerously easy to ignore a serious wound. In this video, we're going to break down exactly how years of high blood sugar take a toll on your body. We'll walk through 5 crucial areas: your blood vessels and stroke risk, kidneys leaking protein, nerve damage in your feet, your retinas, and even your oral health. You'll learn what red flags to look out for, what specific lab tests to request, and why you should never just rely on feeling fine to assume you're healthy. To show you why feeling fine isn't enough, picture a man in his late 60s who has been living with diabetes for years. He still drives to the grocery store, enjoys his morning breakfast, and takes walks around his neighborhood. But at every doctor's visit, his A1C levels are consistently above target. Because he isn't in pain or feeling exhausted, he assumes there's no need to worry. That is, until a routine checkup where his doctor suddenly warns him that they need to closely monitor his kidneys, eyes, feet, and heart disease risks. His story highlights one vital lesson. Feeling healthy on the outside doesn't always reflect what's happening on the inside. When blood sugar stays elevated over time, the excess glucose steadily damages your blood vessels and nerves. The tiny, delicate blood vessels in your kidneys, eyes, feet, and gums often take the hit first. The larger vessels feeding your heart and brain are also at serious risk, especially if you're dealing with high blood pressure or high cholesterol. According to the CDC and the NIDK, prolonged high blood sugar is directly linked to heart, kidney, eye, and nerve damage. So those routine checkups aren't just about looking at a number on a chart. They're about finding out if your most vital organs are silently taking damage. But here's the catch that most people miss. This damage doesn't happen the exact same way for everyone. One person might notice vision changes first, another might feel it in their feet, and someone else might only find out through a kidney lab test. And the very first area we need to take a hard look at is your blood vessels. Key point 5, damage to blood vessels and increased risk of stroke. When your blood sugar stays high for years, it can gradually take a heavy toll on your blood vessels over time. High levels of glucose in the bloodstream can contribute to damaging the inner lining of your vessel walls, making them lose their flexibility. For older adults, this issue becomes even more critical if you're also dealing with high blood pressure, high cholesterol, smoking, carrying extra weight, or living a sedentary lifestyle. Together, these factors can significantly drive up your risk of heart disease and stroke. According to the NIDDK, high blood sugar from diabetes can damage the blood vessels and nerves that control your heart and cardiovascular system. The CDC also notes that people with diabetes are at a much higher risk of developing heart disease or experiencing a stroke compared to those without diabetes. The scary part is that this underlying damage usually doesn't give you any obvious warning signs or physical pain. You can still go about your day walking, eating, and chatting completely normally, even while your blood vessels have been quietly taking damage for years. But when high blood sugar is combined with high blood pressure, high cholesterol, or lack of exercise, your stroke risk can climb significantly. A stroke can suddenly leave you with weakness in your arms or legs, slurred speech, mobility loss, or a long, difficult road to recovery. That's why just feeling fine simply isn't a safe enough guarantee. If you've been living with diabetes for years, don't just focus on your fasting blood sugar numbers. Keep a close track of your A1C, blood pressure, cholesterol, weight, waist circumference, and daily physical activity levels. These are the exact pieces of information your doctor needs to accurately evaluate your overall heart and stroke risks. Every time you go in for a checkup, bring your logbook or your most recent lab results with you. If you notice any of these numbers creeping up over time, don't try to handle it on your own. Always talk to your doctor about how to make safe and proper adjustments. At your next appointment, ask your doctor this very specific question. Based on my current blood sugar, A1C, blood pressure, and cholesterol levels, where does my risk for heart disease and stroke stand, and what should I be watching out for? A question like this helps keep your visit focused on what truly matters. You should also ask what your target A1C level should be, keeping in mind your age, any underlying conditions, and the medications you're currently taking. Never change, skip, or increase your medication dosages without medical guidance. The most important thing is having a clear, safe, and professional monitoring plan. But your blood vessels don't just feed your brain. There's another organ that silently filters your blood every single day. And when it starts to struggle, you might not feel any pain at all. That organ is your kidneys. Key point 4, kidneys leaking protein and declining filtering ability over time. After talking about blood vessels and stroke risk, let's look at the kidneys, an organ many people only pay attention to when their lab results change. In reality, someone in their 70s might go about their daily routine completely normally, with no back pain, no burning when they urinate, and no unusual feelings in their body. But during a routine checkup, their doctor tells them there are traces of protein in their urine and their kidney function needs to be monitored. They're usually very surprised, having always assumed that if there was a problem with their kidneys, their body would give them a clear warning sign. That scenario highlights an important point. Your kidneys can take damage without causing you any obvious pain. Normally, your kidneys filter your blood, holding on to the nutrients your body needs while getting rid of waste through your urine. When your blood sugar remains high for years, the tiny blood vessels inside your kidneys can gradually get damaged. When that happens, your kidneys might not hold on to protein as well as they used to. A specific type of protein called albumin can start leaking into your urine. This isn't something you can see with the naked eye. It typically only shows up on a lab test. If this situation continues, your kidney's ability to filter can decline over time. That is why routine kidney screenings are absolutely essential for anyone who has been living with diabetes for years. The real issue is that your kidneys don't usually give you early warning signs through pain. You might still be eating and sleeping normally, taking your daily walks, yet your urine test already shows protein or your eGFR number has started to drop. If this goes on, your kidney's ability to filter blood can worsen over time. As your kidneys weaken, your blood pressure can become harder to control, your body might retain more water, and your risk for chronic kidney disease goes up. This is exactly why people who have had diabetes for years should never skip their routine kidney checks. If you've been living with diabetes for years, ask your doctor about 2 specific tests, the eGFR and a urine albumin test. The eGFR helps evaluate how well your kidneys are filtering, while the albumin in your urine can indicate that your kidneys need closer monitoring. At your next appointment, ask your doctor, have I had my eGFR and urine albumin tested recently? If not, ask when you should get them checked. This is a simple, proactive way to keep an eye on your kidneys early on, rather than waiting until obvious symptoms appear. And while the tiny blood vessels in your kidneys might suffer in silence, there is another system that can send much clearer signals through feelings of numbness, burning, or tingling. Those are the peripheral nerves in your feet. Key point 3, peripheral nerve damage in the feet. After discussing the kidneys, we need to turn our attention to your nerves, especially those in your feet. When your blood sugar stays high for years, your peripheral nerves can suffer damage. These are the nerves that help your feet feel pain, heat, cold, pressure, and even sense where your foot is as you walk. When these nerves don't work as well as they should, you might experience numbness, tingling, a burning sensation, a dull ache, or pain that gets worse at night. For some people, the problem is the exact opposite. Their feet lose sensation entirely. This means they might not even realize their shoes are too tight, their skin is rubbing, or they have a small blister or scratch. That's why numbness in the feet for someone who has had diabetes for years shouldn't just be brushed off as getting older. The real concern isn't just the numbness, burning, or tingling. If the sensation in your feet decreases, you might not notice a blister, a scratch, an ingrown toenail, or shoes that are too tight. These minor issues can quickly turn into major complications if they aren't caught early, especially for someone who has lived with diabetes for years. Therefore, lingering numbness, burning feet at night, or loss of sensation should never be accepted as just a normal part of aging. In reality, imagine someone in their late 60s wearing a new pair of shoes to the grocery store. While walking, they only feel a slight discomfort, not enough pain to pay attention to it. It isn't until that evening when they take off their shoes that they notice their heel is red and there's a small blister. For someone with normal foot sensation, the pain would have signaled them much earlier. But if the nerves have been damaged by years of high blood sugar, those pain signals can be muffled, causing them to discover the problem much later. Every night, take just 30 seconds to inspect your feet. Check the soles of your feet and your toes to see if there are any blisters or calluses forming. If it's hard for you to bend down, use a hand mirror or ask a loved one to help you check. If you frequently experience numbness, burning, sharp pins and needles pain, hot feet at night, loss of sensation, or if you find yourself stumbling more easily, talk to your doctor. You should also be specific about when these symptoms happen. For instance, after taking a walk while lying in bed, or if they last all day. This information helps your doctor accurately evaluate your nerves, blood circulation, and overall foot health risks. Again, please don't dismiss this as just another sign of getting older. But your feet aren't the only places where tiny blood vessels and nerves can be compromised. There is another organ that is incredibly sensitive to even the smallest changes in your blood vessels, your eyes, and specifically your retinas. Key point 2, retinal damage, blurry vision, and vision loss. After the feet, there is another issue that many people over 60 can easily relate to: changes in their vision. Some might start finding it harder to read prescription labels, having to squint to watch TV, or finding the glare from headlights bothersome when driving at night. They simply think they just need a new prescription for their glasses. But when they go to the eye doctor, the doctor wants to specifically check their retinas because this person's been living with diabetes for years. The retina is the layer at the back of your eye responsible for receiving images and sending signals to your brain. When your blood sugar stays high over time, the tiny blood vessels in the retina can get damaged. Some of these vessels might leak fluid, causing swelling in your central vision area. This can cause you to experience blurry vision, have difficulty reading fine print, or see things less clearly than you used to. In some cases, your retinas can undergo changes before you even notice a clear drop in your vision. Because of this, people who have had diabetes for years need routine eye exams and shouldn't just wait until their vision gets noticeably blurry to see a doctor. The thing to watch out for is that Ewinges in your retina, Kehes, progress slowly and completely painlessly. You might just notice slight blurriness, your eyes tiring quickly when reading, or having trouble seeing at night. Many people assume this is just a normal part of aging or that their glasses are no longer the right fit. But if you've been dealing with diabetes for years, these changes need to be professionally checked. If ignored for too long, vision loss can worsen significantly and treatment can become much more difficult. Pay close attention if your vision blurs quickly. You start seeing dark spots or floaters, flashes of light, have trouble reading fine print, see worse at night, or lose part of your field of vision. Don't just go get new glasses on your own if these signs are obvious or changing rapidly. If you have diabetes, ask your doctor or eye specialist, do I need a retinal exam or a comprehensive dilated eye exam? How often should I be getting checked? You should also be very clear if your vision has changed recently, if it's harder to read or drive at night, or if you're seeing dark spots in your vision. This specific information helps your doctor evaluate your eyes much more thoroughly. And finally, there is a place very close, very easy to see, but many people don't think it's connected to blood sugar. That is your gums and your oral health. Key point 1, gums and oral health are more susceptible to damage. After discussing the eyes, feet, kidneys, and blood vessels, there's one more area people rarely connect to their blood sugar: oral health. When your blood sugar stays high over time, your gums are more prone to inflammation, easily becoming red, swollen, and bleeding when you brush. You might also experience dry mouth due to a decrease in saliva production. A dry mouth puts your teeth and gums at higher risk because saliva plays a vital role in washing away bacteria and protecting your teeth. For some, elevated blood sugar can also make oral infections take much longer to heal. Therefore, bleeding gums, persistent bad breath, dry mouth, or loose teeth shouldn't just be chalked up to getting older. For someone who has lived with diabetes for years, these are critical warning signs that need attention. In reality, imagine someone in their late 60s who notices their gums bleeding every time they brush. At first, they think their toothbrush is just too hard, so they switch to a softer one. But their mouth still feels dry, they still have stubborn bad breath, and their gums remain red and puffy. When they finally go to the dentist asks if they've been keeping track of their blood sugar. That's when they realize their oral health is directly tied to their overall health, especially after living with diabetes for years. Pay close attention to what's happening in your mouth on a daily basis. If you frequently notice red and swollen gums, bleeding when brushing, chronic bad breath, dry mouth, gum pain, loose teeth, or mouth sores that take forever to heal, don't ignore it. Be sure to brush gently with a soft bristled toothbrush, floss, or clean between your teeth regularly. Drink plenty of water and keep up with your routine dental cleanings. Most importantly, monitor your blood sugar as directed, because properly managing your glucose levels is a crucial part of protecting your smile. If these signs keep popping up, talk to your dentist and the doctor managing your diabetes. You can ask your dentist, could my gum issues be related to my blood sugar? And ask your doctor, how might my current blood sugar levels be affecting my oral health? Don't just try to mask the problem long-term with mouthwash, changing toothpaste, or using DIY home remedies. If you have frequent gum bleeding, loose teeth, gum pain, or any signs of an infection, get it checked out by a professional right away. Now, let's do a quick and simple recap. If you've been living with diabetes for years, don't just look at a single daily blood sugar reading. Remember the 5 key areas of your body that need regular monitoring. Number 1 is your blood vessels. Keep a close eye on your A1C, blood pressure, cholesterol, and stroke risk. Number 2 is your kidneys. Ask about your eGFR and a urine albumin test. Number 3 is your feet. Watch out for numbness, burning, tingling, loss of sensation, or any small wounds. Number 4 is your eyes. Pay attention to blurry vision, dark spots, flashes of light, or trouble seeing at night. And number 5 is your oral health. Look out for bleeding gums, dry mouth, persistent bad breath, or loose teeth. Having these signs doesn't guarantee you're definitely facing complications, but they are vital pieces of information. Your body won't always warn you with obvious pain. Sometimes even a minor change is enough reason to get things checked out more thoroughly. High blood sugar is never a reason to blame yourself. It's simply a condition that requires consistent monitoring, proper care, and a solid plan. The most important thing is that you don't ignore your body, don't change your medications on your own, and don't wait until things get worse before asking your doctor for help. If this video helped you better understand prolonged high blood sugar, please share it with a loved one living with diabetes or prediabetes. Chances are they might also be thinking, I feel fine, so I must be okay. In our next video, we'll be talking about the signs of high blood sugar after meals that many older adults tend to overlook. This video is for informational and educational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should always seek the advice of a qualified healthcare provider before adopting any of the practices mentioned.